The eye sclera readings can help determine if the body is cooperating or not. They are not iridology, iris readings. Iris readings are some sort of semi-science that supposedly can spot maladies, but eye sclera is merely to cross-check that the body is cooperating. Perhaps the easiest way to explain eye sclera readings is to read from Dr. Beddoes' book, Chapter 17. The blood vessels in the sclera are very delicate channels. It is the only place in the whole body where blood vessels can actually be observed in their uncovered state. These vessels are very highly subject to showing a sort of sympathetic reaction when parts of the rest of the body are under an extra load. The load that is showing relates to the energy loss in the glands, organs, and tissues. When an organ or tissue of the body is not being provided for because of the lack of mineral energy to the liver, the breakdown products will be increased in those parts of the human system. It appears that the overload will demonstrate reflex changes in the vessels of the white of the eye. Experience has shown that the greater the number of enlarged blood vessels on the vertical axis that appear in the sclera of the eye, the greater the amount of delta cells the kidneys are trying to throw out, but not completely succeeding. When the kidneys are not removing all the cellular debris which they should, the arterial blood supply is put under greater pressure, and this will usually appear in the vertical arteries of the sclera, showing an enlargement due to dilation from back pressure. The vertical vessels also show reflex relations to capillary dilation in areas of delta cells above the waistline. On the other hand, the enlarged vessels that appear on the horizontal axis of the sclera will usually be showing that nature is trying to cooperate by mobilizing the dead and dying tissue in an effort to get it out of the system. These horizontal vessels will most likely be veins, which is indicative of a greater amount of waste exiting areas of the body below the waistline. Thus, the dilation is due to the large volume of dead cell removal through the veins from capillaries at the cell level. So it is vital that a person continue following the proper chemistry principles for the system in order to help nature accomplish what she is trying to do. As a person follows the program, the sclera readings can be used as a cross-check to see if nature is still cooperating. As nature cooperates, you should see a larger number of vessels. Whether they are on the vertical or horizontal axis of the eye is usually according to the congestion being either pre-cell or post-cell. When the line of least resistance is holding properly and the eye readings show that the body is cleansing, then all is well. It is possible to expect more healing crises or withdrawal symptoms when the kidneys are not able to clear the dead cell debris fast enough. This would mean that the body will use other avenues for waste and toxin removal. If a person is following the program faithfully and the sclera vessels disappear and the chemistry is not right, then this is to be of concern. This is an indication that the body is not cooperating. This means the metabolic waste is not being mobilized and removed. This is a sign of extreme breakdown because the body cannot rebuild unless the dead cells are removed. So in simple terms, the sclera readings are a verification of the cause and effect of energy loss or energy gain. These readings are only to be used as a cross-check and never for analysis. For this reason, the application of the scleral evaluation is not included in the main body of information in this book. Experience in the past has shown that many students sometimes tend to place excessive emphasis in the scleral information beyond what was intended, and this does distort its primary value. Here we see a chart with marks on it. These marks indicate the major red blood vessels that we're showing in the eye. Here Charlotte is using a small flashlight to illuminate Michael's eyes so that she can get a good sclera reading. Look up, look down, look left, look right. Many of you have heard those words before. The completed chart looks about like this. It must be understood, as in the long description before, sclera readings do not indicate illness in any particular spot. They are simply a verification that the program is working right, that the diet and hydration is doing the job. If those red lines all disappear, and yet you know somebody's full of delta cells, there's trouble. So you have to back up then and see what's going on. You do not run this sclera examination that often. It's not each time you run the test. This is just for you to keep track of whether this person's body is responding properly. As with all other parts of Rbti analysis, no diagnosis, no medical diagnosis is implied, suggested, considered. You're merely looking in someone's eyes to make your evaluation as to whether they're getting okay, in the same sense that if a friend had a hangover and he said, "My eyes are bloodshot, what do you see?" and you'd look in his eyes. It's not diagnosis. It's not meant to get anywhere near diagnosis. As opposed to Rbti, which does not diagnose, the iridology charts are a method of diagnosis. It's not accepted by doctors or medical doctors, but Rbti does not touch that, not interested, finds no value in it. We're simply trying to get the body chemistry to get a little better so that health can flow. Has nothing to do with diagnosis, and if someone accuses you of diagnosing, please ask them to stop and correct them so that you don't get caught up in that.